I'm Professor Sir Mark Caulfield, and I'm Vice Principal for Health at Queen Mary University of London, and by training a Professor of Clinical Pharmacology, so I'm a medical doctor who tries to train other doctors in rational and safe use of medicines.
Excellent. And what has brought you to APAM 26?
So I've come today to give the George Griffin Lecture, which is a very prestigious honour, and that is focused on the 100,000 Genomes Project and transforming genomic medicine, which is something I was heavily involved in as its chief scientist between 2013 and 2021.
Right, and that transformation of genomic medicine is, how do you feel it's going? Is it happening fast enough? Is it being accepted widely enough? What's your take on where we are?
These are very good questions. So in 2013, the landscape I encountered was of huge regional variation in access to genomic testing, people not getting diagnosis, people not using it in cancer to choose therapies or to spot possible risk of harm, and it wasn't being widely used in infection. Today we have a genomic medicine service that's the envy of the world. It's got regional equity of access for 56.7 million people in England, and Scotland, Northern Ireland and Wales are following suit. We're the only country in the world who, from direct healthcare, free at point of care, do we deliver whole genome sequencing, which is as much as I can read of your blueprint for your life, really.
Right, excellent. And are you finding, because obviously one of the big things that I'm hearing about APAM 26 is the next generation, the next kind of people who are coming through working in medical research. Are you finding that enough people are wanting to go into genome work?
So I think it is an area of growth, and I think there's a lot of enthusiasm about it. But I'm going to say something more broadly, because the really important thing that the Association of Physicians does is focus on young people. The young people are our future, they're our successors, and we have to invest in them. In my career, when it was early on, young people weren't necessarily treated terribly well. But now, through the Association of Physicians and their activities, we're really trying hard to nurture those young people, build their confidence, and make sure that they can see a future life in clinical academic medicine. And the reason that's vitally important is between 2011 and 2021, we lost over 181 clinical academics across this country.
Wow.
So they'll never come back unless we rebuild them. And unless we look after our young people, we won't rebuild them.
Absolutely.
So we have an enlightened self-interest as a community to make sure the future of patient well-being and transformed healthcare is seen as being fundamentally about encouraging these young people, giving them a great start in life, making them as excited as we were about what we're doing, and therefore we will be able as a nation to move forward and remain at the forefront of global medicine.
Yeah. Are you as excited now as you were when you were younger, do you think?
Yes, in many ways more excited. Partly that's because I probably don't have much time left, so I have to be excited and try and get everything done quickly.
No.
Whereas when I was younger, I might have said, "Oh, plenty of time." Not to worry. But I'm as excited. I've listened to fabulous talks by wonderful young people today. I'd be excited to work with any one of them. And some of the old people haven't done too badly either. But I do think that what we're doing here is very important to the future. This is the only gathering of its type where a group of completely unrelated clinical specialists come together and share research to a bunch of people who may not know very much about their area, but actually there's fabulous learning, it stimulates ideas, and the success of modern medicine is about interdisciplinarity.
Yes.
Can you combine disciplines to take the sum of the parts to synergy?
Yeah.
And if you can, then it's a fabulous opportunity.
Absolutely. I think just before we let you go, we've got to mention that you received an award recently.
Yes.
Can you tell me a little bit about that?
I did receive an award. I received the George Griffin Medal this afternoon. Earlier today, I've got it here. Do you want to see it?
Nice.
think I've got it here. No, yes,
Oh,
I won't know. I've left it in the room I was in there, but I'll bring it over in a minute. But also, I've received a number of awards over the last few years related to this work on the 100,000 genomes and its transformative impact.
Right.
And I think what I've learned from that, probably the abiding thing that I would say is involve the NHS as early as possible and involve participants and patients even earlier.
Right.
So that they can be really at the heart of everything you do, and then you will get it into the NHS very much quicker.
Okay. And the final question that I'm asking everybody, there's going to be people watching this of a more experienced generation, there's going to be medical students watching this. Why should they think about attending APAM 27?
Look, I think this is a unique meeting where a group of people from unrelated disciplines get together. So for young people, for networking, I think it's a great opportunity. For medical students who are curious about research, it's also a big opportunity. Tomorrow morning, I'll be talking at 8:30 with the early career researchers and medical students for an hour about the things that are on their minds and seeking to inspire them to feel the same enthusiasm I once did for this career. I still feel that enthusiasm, it's undiminished, but what I would say is in the modern world, things are more complex than they were for us, and many of our students graduate with substantial debt, so their minds may not be on the uncertainty of a career in research and all of the risks that that involves, but rather more on getting to a secure future with a secure job. And our job is to be mentors and support them to get that security through the backing we give them to win the funds that they can succeed with.